The purpose of the Destiny study was to look in the UK at firstly a group of patients who'd been quite widely studied in other countries, but also to look at an additional group of patients who are in major molecular response but not necessarily MR4, which is the group that everyone else has looked at. So to extend the boundaries, if you like, of TFR study. And the other thing we wondered about is that patients may not be able to completely come off their drug, but they may be absolutely fine on a lower dose. So that was the setup, and we recruited 174 patients over about a year and a half. And we now have the complete follow-up, which is the 3-year point, looking at what happened to a year of half-dose therapy, followed by 2 years of complete cessation. And we divided the patients into 2 groups, which are different. It's not obviously randomized. Those who were in stable MR4, and those patients, 72% were able to complete the study, and also into a group of major molecular response patients who were not necessarily as good as that. And those patients, the results were not so good, but nevertheless 36% of patients were able to complete the study. So we end up with 2 major conclusions. Firstly, that patients may be more successful in their TFR attempt if they first de-escalate the drug to something lower. I'm not saying for a moment our approach is optimal, but it would be nice to see further studies along this line. And the second conclusion is that even in patients who are less well controlled, but still in major molecular response, it's still worth a try, as long as the patient is keen to do so.